आप सभी लोगों को मेरा नमस्कार। मैं डॉक्टर दीपक शर्मा, दिल्ली होम्योपैथिक मेडिकल एसोसिएशन का जनरल सेक्रेटरी आप सभी लोगों का स्वागत करता हूं। लॉकडाउन के दौरान आज हमारा ये 21वां वेबिनार है। लगातार दूसरे दिन वेबिनार करने का हमने जब सोचा था तो हमें लगा कि यार बहुत सारे लोग ऐसे हैं जो शायद हमारे वेबिनार से बोर ना हो जाएं। लेकिन मुझे लगता है कि आज हम जब डॉक्टर अरिबेन सुकुल जो हमारे आज के स्पीकर हैं उनके साथ हम एक टेस्ट ट्रायल ले रहे थे 8 बजे, तब भी हमारे पास बहुत सारी ज्वाइनिंग आ गई थी। और सबसे अच्छा लगा, मैंने आपको पिछली बार भी बताया था, कुछ ऐसे कमेंट आए कि अब रामायण और महाभारत की तरह हम लोग भी डीएचएमए के वेबिनार्स का वेट करते हैं। तो ये मुझे बहुत अच्छा लगता है। दिल्ली होम्योपैथिक मेडिकल एसोसिएशन की तरफ से मैं आप सब लोगों का धन्यवाद करता हूँ। आज जो लोग नए हैं मैं उनको बता दूं कि दिल्ली होम्योपैथिक मेडिकल एसोसिएशन 1932 में डॉक्टर युद्धवीर सिंह सर द्वारा बनाई गई थी। और डॉक्टर युद्धवीर सिंह सर दिल्ली के पहले हेल्थ मिनिस्टर रह चुके हैं। उन्होंने नेहरू होम्योपैथिक मेडिकल कॉलेज और दिल्ली में बहुत सारी होम्योपैथिक मेडिसिन जो डिस्पेंसरीज हैं उनका भी निर्माण किया। आज दिल्ली होम्योपैथिक मेडिकल एसोसिएशन का जनरल सेक्रेटरी होने पर मुझे बहुत गर्व होता है और मुझे अच्छा लगता है कि मैं आप सब लोगों को दिल्ली होम्योपैथिक मेडिकल द्वारा जो कंटिन्यू उनकी सीएमई है जो 1932 से चली आ रही है, बहुत सारे सेमिनार्स के साथ भी, बहुत सारे और होम्योपैथी के लोग करके जितने भी वर्क हुए हैं उन सबको हम आगे बढ़ा रहे हैं और इसका मुझे सौभाग्य मिला है। इसके लिए आप सब लोगों का धन्यवाद। आज हमारे साथ हमारे जो को होस्ट हैं वो हैं डॉक्टर वीपी सिंह सर और डॉक्टर श्वेता सिंह। डॉक्टर वीपी सिंह सर दिल्ली होम्योपैथिक मेडिकल एसोसिएशन के पैटर्न हैं और डॉक्टर श्वेता सिंह वाइस प्रेसिडेंट हैं। तो मैं चाहूँगा कि आज की हमारी को होस्ट डॉक्टर श्वेता सिंह हमारे आज के स्पीकर डॉक्टर अरिबेन सुकुल का स्वागत करें और उनका इंट्रोडक्शन करें।
Welcome, sir. So I would like to introduce our speaker, Dr. ANIRBAN Sukul. He is BHMS, MSc, PhD, and DIH Home, London. He is director of Sukul Institute of Homeopathic Research in Kolkata, and he is also a research committee member of LMHI, Germany. He is an editor, he is a clinician, he is a experimentator, researcher of India, and he is in board of editors in many journals, international journals like Journal of Neurodegenerative Diseases and Disorders, USA, Journal of Pulmonology and Clinical Research, London, Journal of Phytochemistry and Biochemistry, USA, Journal of Microbiology and Biotechnology Reports, London. So he will be discussed with us today the topic biological effects of homeopathic dilution. So very welcome, sir, to our platform.
In short, he is a master of homeopathy and all-rounder, you can say. And Dr. VP Singh sir, please welcome our speaker today.
डॉक्टर दीपक, पहले तो मैं आप ही का स्वागत करता हूं। दूसरा, डॉक्टर अनिर्बान का अभी फोटो नहीं आ रहा है, इसको भी जरा दिखाएं।
अच्छा सर, आ रहे हैं, आपकी वीडियो के नीचे हैं।
अच्छा, फोटो नहीं आ रहा है उनका।
सर हमें दिखाई दे रहा है, आप स्क्रॉल करेंगे तो दिख जाएगा।
अच्छा
जी।
तो मैं दिल्ली होम्योपैथिक मेडिकल एसोसिएशन के बिहाफ पर डॉक्टर अनिर्बान सुकुल का मैं बहुत स्वागत करता हूं। आज का जो वेबिनार है, और मुझे लगता है कि बायोलॉजिकल इफेक्ट्स ऑफ होम्योपैथिक डाइल्यूशंस एक बहुत ही एक अलग ही टॉपिक मुझे लग रहा है ये, जिसमें कि मैं समझता हूं कि हम लोगों को भी और हमारे जितने भी जूनियर्स हैं उनको बहुत ही एक बहुत ही प्रैक्टिकल नॉलेज मिलने वाली है। इसी संदर्भ में मैं डॉक्टर सुकुल का बहुत बहुत स्वागत करता हूँ।
थैंक यू सर। एंड दिस इज एक्चुअली ए नीड ऑफ डे and homeopathy actually need a study and the research. So welcome Dr. Ariban Shukul and namaskar. So please continue with your lecture and we are all waiting to listen you.
Thank you. Thank you, Dr. Sharma, Dr. VP Singh and Dr. Sweta for giving me a nice introduction for me to all of the viewers. And I really welcome to all the viewers for being a part of this lecture that have been continued for I think 15-16 webinars have already been done by the Delhi Homeopathic Medical Association. It has been really an excellent job that they have been doing, and I appreciate and it's a very promotion of homeopathy research, homeopathy clinical, experimental, both. So I right on to move to the presentation, PowerPoint presentation, and I especially thank to Dr. Deepak Sharma for giving me the opportunity to speak over here. I now move on to my presentation. Please be there.
Sure.
So, welcome back to all the viewers. And I know there are many international viewers from Thailand, from Malaysia, from Philippines, who have confirmed me that they are going to join here. And if they haven't come yet, I think they will come soon. So my topic today, as I have a background of researcher, I am a mastered in zoology in the year 1995, and thereafter I got into the PhD program in Vishwabharati University in Shantiniketan. And the chancellor of this university is the Honorable Prime Minister, Mr. Narendra Modi today. So it's a university of repute, and it's being founded by Rabindranath Tagore. I am really privileged to being a part of this university as a student, and my PhD is from this university. Thereafter, I got research associate under the DSA UGC program from University Grants Commission, and that was my research associated part. So this was the background of my research. Although I am now as a clinician, I work as a homeopathy doctor. I work as a researcher with the homeopathic dilutions. We have our Sukul Institute of Homeopathic Research being established in the year 2000. And we have collaborations of the universities from India, research institutes from India, as well as abroad. We have many publications on this research on high dilutions. And this high dilution is a very technical term that is being used in place to not to use the word homeopathy, because it has a big dispute in the scientific research. It is because they are using the okay, so they are using the medicine which are too diluted, which should not have any molecules of that drug, of the same drug. So it uses the medicines which are beyond the Avogadro number. So there are so many other factors that arises these such controversies, and we are still with it. Scientists throughout the world, they are working very hard with this homeopathic dilutions.
Dr. Arivind sir.
Yes.
I think your sharing screen is stopped. So please share it again.
Is it?
Yes, yes, sir.
Okay, thank you.
Thank you.
So the scientists all over the world, they are very optimistic with the challenge that they one day the controversies behind the dilution of homeopathy medicines will be totally erased. So there is our effort to this challenge is my topic today, and my lecture as well is the biological effects of homeopathic dilutions. So as all the doctors, they have introduced me very nicely. Still, this is my duty to all the viewers, those who have joined currently. And this is me, the Dr. ANIRBAN Sukul from India, from Kolkata. And I am the director of Sukul Institute of Homeopathic Research. We have also collaborations in clinical research in Bangladesh and Thailand and the Philippines. I purposefully made it a different slide, as a separate slide is because that homeopathy, as I pointed you out, it's a tremendous controversial subject as far as the clinical, I mean the experimental research or the laboratory-based research is concerned. I am the editor of Clinical and Experimental Homeopathy, which is being published by Sukul Institute. It's a homeopathic journal and related to its clinical and experimental research. But I am in the board of editors in several other journals, those who are nowhere related with homeopathy. It's a journal like Journal of Neurodegenerative Diseases and Disorder from United States, Journal of Pulmonology and Clinical Research from London, Epidemiology, Journal of Phytochemistry and Biochemistry, United States, and Journal of Microbiology and Biotechnology Reports from London. You can see from the names that they are nowhere related with homeopathy, and they do not publish. Moreover, this is not in their area to publish homeopathic articles, but they thought it is very necessary to hire a people of a background of homeopathy or alternative medicine, which is me. So I review all of their papers, those who have submitted related to the alternative medicine, and this is the end. So you can see that it's not only in the clinical part, but as well as the research laboratories. They work a lot of research with related to this neurodegenerative disorders or the pulmonology, whatsoever, or all these kinds, along with homeopathic, I mean the alternative medicines, homeopathy, herbal medicines, and they need to publish this their work into such journals. So they have their expertise, I mean referees of a background of alternative medicine or herbal medicine or traditional medicine or homeopathy. So this is our research that writing reflex model, the basic research with animal models. As you know, that alcoholism is a global problem. It's not only the problem of the person who is consuming, it's the problem of his family and with the society he is living with. So it's a global problem with the health issues, some criminal activities, and so on and so forth. In homeopathy, Nux vomica is considered as the potential anti-alcoholic medicine. So what we did, we used this Nux vomica in the writing reflex model. Now, what is writing reflex? Writing reflex is the normal erect posture of an animal, that we are sitting erectly does mean that our writing reflex is correct. So maintaining our writing reflex, we maintain our normal posture, whether it is sitting, whether we walk, whether we stand. If we lose, or if we tend to lose our writing reflex, we may tend to fall. Overdose of alcohol is the cause to loosening its writing reflex, and in turn, sometimes you will see that the over intoxication of alcohol, some people may lie on the street after taking too much of alcohol. So this is exactly the overdose of alcohol, and that is total loss of writing reflex, and that causing the man to lie down on a street, which is not a normal posture. There are other medicines as well which work on the alcohol, but we choose Nux vomica because it is in our clinical practice, we found that it is very much effective. What we did in order to experiment with homeopathy medicines, we have to have the symptoms first. We have to obey the homeopathic principles. That is, with the symptoms, we have to select the medicine. Without any symptoms, we cannot do anything. It is because the mice, they will not able to tell you the symptoms, what they have. So we have to create the symptoms, which is similar to the loss of writing reflex. As I told you that overdose of alcohol will cause the loss of writing reflex. So what we did is to put the ethanol injection into the intraperitoneum of mice, in batch of mice, It is 4 gram per kg body weight. The ethanol injection was there. And after a certain period, there is total loss of writing reflex, and the batch of mice, they will be in their sleep time. This is exactly not the normal sleep that you enjoy every night, but this is a special term that is coined and is being used with such kind of experiments with writing reflex. So after injection, intraperitoneal or IP injection of ethanol, immediately they lose their writing reflex. So, and they will fall on one side. Once they fall on the side, we start counting the sleep time. There is a cutoff time of 300 seconds of the sleep times. So we will count only 300 of the mouse, those who will be sleeping for 300 seconds. After 300 seconds, there is no more counting. You can see this is the administration of homeopathy medicine through the oral route, through micropipette in our laboratory. Here comes the result of the writing reflex.
Hello. Hello, Dr. Sukul, are you there? Dr. Shweta, you just please tell us more about DHMA. Till then, I will call Dr. Sukul.
जब तक डॉक्टर सुकुल हमें ज्वाइन करते हैं, मैं डीएचएमए के बारे में आपको बताना चाहूँगी कि this is the association, this is the oldest homeopathic association working for the awareness of homeopathy since 1932, and it is founded by Dr. Yudhvir Singh, who is the first health minister, government of India, and he is the first president of the board of homeopathic medicine. And so from जब से लॉकडाउन शुरू हुआ है, तो we have started our webinar series every alternate day, and we got so much reviews and good reviews from our viewers, and day by day we are providing with very nice lectures, and we have हम बहुत ही अच्छे जो स्पीकर्स हैं उनको आपके साथ हमने जोड़ा है, उनको हमने बहुत सुना है। और मैं चाहूँगी अपने पैटर्न डॉक्टर वीपी सिंह सर से कि प्लीज सर आप डीएचएमए के बारे में और भी जानकारी हमारे व्यूअर्स को दीजिए।
DHMA की बात है, डॉक्टर श्वेता along with all the participants who are visiting today's webinar, which is presented by our learned speaker Dr. ANIRBAN Sukul from Kolkata, और subject is the biological effect of homeopathic dilutions। तो इस तरह के वेबिनार आप देख रहे हैं, मैं समझता हूँ ये 21वां वेबिनार है। तो अभी तक जो हमको जो इसके बैक रिपोर्ट्स मिली है बहुत ही अच्छी मिली है, और इसका कोई किसी तरह का कोई किसी अर्निंग करने का कोई तरीका डीएचएमए का इसमें नहीं दिख रहा है। ये सब जो है नो लॉस नो प्रॉफिट के बेस पर चल रहा है। दिस इज ओनली फॉर के इन दो महीने के लिए हमारी जो मंथली मीटिंग होती थी वो नहीं होने पर मैं इस जो हमारी प्रेजेंट कमेटी है उसको मैं बहुत बहुत धन्यवाद देना चाहता हूँ कि उन लोगों ने इतना समय निकाल करके हम लोगों को इस तरह से इसमें एंगेज करके रखा हुआ है। और आए दिन जो है बहुत अच्छे अच्छे स्पीकर्स ये हमको सुनने के लिए देते हैं और बहुत अच्छी नॉलेजफुल बातें हम DHMA के इस प्लेटफॉर्म पर ला करके हम एक हायर कैटेगरी के एक स्पीकर को, स्टूडेंट्स तक को भी, इंटर्न तक को भी DHMA ने अपना प्लेटफॉर्म प्रोवाइड किया है, जो अभी तक बहुत अच्छा सभी लोगों ने इस चीज़ को एप्रिशिएट किया है। बहुत बहुत धन्यवाद।
डॉक्टर सुकुल कनेक्ट हो रहे हैं थोड़ी देर में। जब तक मैं आपको बता दूं कि जो होम्योपैथी की आज की नीड है वो बेसिकली रिसर्च है। वो चाहे किसी भी दिशा में हो, हमें अपने केसेस, हमें अपनी डिजीज, हमें अपने पोटेंसीज, हर एक चीज़ के बारे में हमें रिसर्च बेस्ड साइंस को डाटा देना पड़ेगा, तभी होम्योपैथी साइंस में आगे आएगी। मैं आप लोगों को बता दूं कि अगर हम लोग बात करते हैं कि जो रिसर्च हैं वो कहाँ तक किस बेस पे हैं, तो हम लोग जब छोटी सी, मैं कभी कभी अपने सेमिनार्स में पूछता हूँ कि डॉक्टर्स ये बताइए कि जो आपके ग्लोब्यूल्स बन रहे हैं वो किस चीज़ से बन रहे हैं, तो मैक्सिमम डॉक्टर्स को तो ये भी शायद मालूम नहीं होता कि वो जो ग्लोब्यूल्स हैं वो किस चीज़ से फॉर्म हो रहे हैं। हम लोग अभी रिसर्च में इतने पीछे हैं। मैंने एक साइंटिस्ट हैं, मैं उनका नाम नहीं लेना चाहूँगा, बहुत बड़े साइंटिस्ट हैं हमारे काउंसिल के, रिसर्च काउंसिल ऑफ होम्योपैथी। तो जब मैंने उनसे बात करी कि हमारे पास रिसर्च के लिए सर क्यों ऑप्शंस नहीं हैं, तो उन्होंने मुझे जवाब दिया कि डॉक्टर साहब ऑप्शन कैसे होंगे कि जब हमारी मेडिसिन में मॉलिक्यूल ही नहीं है तो हम लोग कैसे रिसर्च कर पाएंगे और कैसे वो सब काम होंगे। तो मैंने उनको सिर्फ एक ही सवाल किया था कि आप 30 पोटेंसीज को तो छोड़ सकते हैं, लेकिन आप 3x को, 1x को, 6x को कैसे भूल सकते हैं, जहाँ पे प्योरली मटेरियल डोज होती है। और ये एक्चुअल में अभी तक हम लोग इस फार्माकोलॉजी पे भी नहीं पहुँचे हैं कि हमारी जो 6x है, हमारे जो मदर टिंचर्स हैं, वो फार्माकोलॉजिकली कैसे काम कर रहे हैं। इसके लिए मैंने आपको पिछली बार डॉक्टर गिरीश गुप्ता सर से भी मिलवाया था। उन्होंने CDRI में कुछ रिसर्च की थी। ऑलरेडी CDRI में कुछ होम्योपैथ के लिए साइंटिस्ट ने रिसर्च करी थी, और ये काम हम डॉक्टर्स का नहीं है कि हम लोग रिसर्च करेंगे। वी आर डूइंग द प्रैक्टिस। रिसर्च करने का काम होता है रिसर्चर्स का या साइंटिस्ट का। तो साइंटिस्ट को ये चाहिए कि ये ढूंढ करके निकाल लें कि होम्योपैथी में मॉलिक्यूल क्यों नहीं है, या जिसमें मॉलिक्यूल है कम से कम उसी के बारे में बता दें। जब मैंने बात की थी और जब मैं CDRI में काम कर रहा था अपने एक कोलीग के साथ, डॉक्टर प्रीति वर्मा नाम है, और उन्होंने मुझे बहुत अच्छा सा स्पेस दिया कुछ रिसर्च मॉडल पर काम करने का, और हम लोगों ने पल्सला 1x पे काम करना शुरू किया था। बाई चांस क्योंकि CDRI में जो होम्योपैथिक डॉक्टर्स हैं उनके लिए रिसर्च अभी तक भी ओपन नहीं है। हम लोगों को इस पे काम करना चाहिए। हमारे जो काउंसिल के मेंबर्स हैं उनको इस चीज़ पे काम करना चाहिए। आज भी मैं देखता हूँ कि जब हम लोग इस मुश्किल समय में हम लोग किसी एक मेडिसिन को लेकर के आते हैं, मतलब हमारी काउंसलिंग हमारी जो काउंसिल है, सेंट्रल काउंसिल, ये कहती है कि एक मेडिसिन है जो आपको देनी है एज ए प्रोफाइलेटिक। उसके बाद भी सारे अपने लोग अपने ही प्रोफेशन में अलग अलग मेडिसिन लेकर के अलग अलग सोशल मीडिया पे अलग अलग पोस्ट जारी कर देते हैं, बिना किसी एविडेंस के, बिना किसी बायोस्टैटिकल डाटा के। तो यहाँ होम्योपैथी थोड़ा मात खा रही है। दिल्ली होम्योपैथिक मेडिकल एसोसिएशन के लिए मैंने आपको पहले भी बताया था कि हम लोग कोविड-19 पर कोई भी वार्तालाप नहीं कर रहे हैं, और हम आपको शायद बाद में ही बताएं कि दिल्ली होम्योपैथिक मेडिकल एसोसिएशन कोविड-19 के लिए क्या कर रहा है, क्योंकि ये एक स्टैटिकल डाटा होगा, और जो भी ये डाटा होगा वो ऑथेंटिक डाटा हो सकता है मैं भी कहीं फेल हो जाऊं, लेकिन हम लोग कोशिश कर रहे हैं कि हम लोग एक ऑथेंटिक डाटा लेकर के हम अपनी काउंसिल को प्रेजेंट करें। मैं चाहता था कि जितने भी हमारे ऐसे जो बड़े लोग हैं जिन्होंने अपनी अपनी मेडिसिन जो हैं वो बताई फेसबुक पर, जिसकी वजह से सब लोग मेडिकल स्टोर पहुंचे, हमारे पास ही पोस्ट आई कि सर कैम्फरवानम ले लीजिए, या फेरामेट ले लीजिए, या फिर दूसरी मेडिसिन ले लीजिए। तो जब हम लोग अपने काउंसिल को एक साथ नहीं रख पाते, हम अपने काउंसिल का ही कहना नहीं मान पाते, तो फिर हम आगे कैसे बढ़ेंगे। हमें चाहिए था कि हमारी जो भी रिसर्च है वो चाहे जिस भी मेडिसिन पे हम अपनी काउंसिल को भेजें, और काउंसिल इस बात का जवाब दे कि हमारे पास ये रिसर्च स्टडीज आई हैं और ये कंक्लूजन निकला है। तो मेरी आप सब लोग होम्योपैथी डॉक्टरों से ये प्रार्थना है कि आप जब भी कोई स्टडी करें तो आप सीधे काउंसिल को भेजिए, ताकि काउंसिल उस पर काम करे, काउंसिल उस बात को समझे, काउंसिल इस बात को कॉन्ट्रैक्ट करे। और ये नहीं कि आप अपने आप पोस्ट बना करके अपनी मेडिसिन निकाल करके अपने तरीके से देना शुरू करें। हो सकता है इंडिविजुअलाइजेशन शायद इसी को कहते हों, लेकिन रिसर्च बहुत ज़रूरी है। हम होम्योपैथी में रिसर्च के मामले में शायद बहुत पीछे रह गए हैं। इतना सारा साइंटिफिक डाटा होते हुए भी, इतने सारे केसेस ठीक होते हुए भी मतलब मैं जानता हूँ कि ऐसे ऐसे फिजिशियन से मैं मिला हूँ जिनकी जो डेली की ओपीडी है वो शायद 200 से 250 पेशेंट पर डे की है। ऐसे भी फिजिशियन से मिला हूँ जो सिर्फ पूरे दिन में 2 पेशेंट्स का अपॉइंटमेंट लेते हैं। तो सभी पेशेंट डॉक्टर से जब मैंने वार्तालाप की और पाया कि जो भी बायोस्टैटिकल डाटा है वो शायद कोई भी अरेंज नहीं कर रहा है, और कोई भी बायोस्टैटिक्स के हिसाब से होम्योपैथी को आगे ले जाने के लिए काम शायद बहुत ही कम लोग कर रहे हैं, और जो लोग कर रहे हैं वो उसी में उलझे हुए हैं। जैसे मैंने शायद जब मैं पढ़ता था तो एक डॉक्टर से मुलाकात हुई थी, वो अपने कुछ रीनल स्टोन्स में स्टडी कर रहे थे, और उसी समय मुझे पता लगा था कि उनकी जो रिसर्च है वो बायोस्टैटिक्स के हिसाब से है और वो बहुत अच्छा सा अरेंज कर रहे हैं, लेकिन अभी तक वो पब्लिश नहीं कर पाए इतने दिनों में। तो उनके साथ भी कुछ दिक्कतें रही होंगी, क्योंकि बायोस्टैटिक्स जो कहती है उसके हिसाब से डाटा प्रेजेंट करना थोड़ा मुश्किल होता है। हमें सिर्फ सेमिनार्स, हम अपनी CMEs, हम अपने जितने भी वेबिनार्स, जितने भी केसेस देखते हैं, हर एक डॉक्टर से ये सुनते हैं कि हमने किसी भी पेशेंट को देखा, हमने दवाई दी और हमने ये केस ठीक कर दिया, लेकिन एक्चुअल में कैसा हुआ उसको बायोस्टैटिक्स के हिसाब से कैसे देंगे ये शायद कोई भी नहीं बता पाता। इवन जब मैं बहुत सारे लोगों से पूछता हूँ कि जब डॉक्टर हैनीमैन सर ने तीसरे एफोरिज्म में प्रॉपर डोज की बात कही थी, तो शायद प्रॉपर डोज के बारे में ही मैक्सिमम लोगों को नहीं पता होती। 30 नंबर का ग्लोब्यूल का सिग्निफिकेंस, 40 नंबर के ग्लोब्यूल का सिग्निफिकेंस, ये कौन बताएगा कि 10 देने हैं, 4 देने हैं, 3 देने हैं, या कौन ऐसा कहता है कि 15 ड्रॉप आधे कप पानी में मिलाओ दिन में 3 बार, ये कैसे डिफाइन करेंगे? तो ये अलग अलग सेक्टर्स हैं हमारे। जस्ट ए मिनट, डॉक्टर अनिर्बान सुकुल का फोन है। सॉरी। तो ऐसे बहुत सारी रिसर्च के सेक्टर्स हैं जहाँ होम्योपैथी को बहुत ज़रूरत है। इवन एक डोज पर भी, वो जो एक डोज है वो कितने ml की होनी चाहिए, इस पर भी रिसर्च की ज़रूरत है। ये नहीं है कि आपने किसी भी डोज को लिया और 1 ड्रॉप आपने डाल दिया। 1 ड्रॉप कितनी बड़ी होती है एग्जैक्टली, 1 ड्रॉप कितने ml की होनी चाहिए, इस पर भी काम होना बाकी है। तो आप सब लोगों को मैं एक और तोहफा देता हूँ। आज हमारे साथ हमारे जो सीनियर हैं डॉक्टर RN वाही सर, दिल्ली होम्योपैथिक मेडिकल एसोसिएशन के बहुत सीनियर मेंबर भी रह चुके हैं, और सर आपका स्वागत करता हूँ बहुत बहुत।
धन्यवाद धन्यवाद
सर आपको सब लोग सुनना चाहेंगे। आपको वैसे सभी लोग जानते हैं, आपका इंट्रोडक्शन देना तो मेरे लिए तौहीन वाली बात हो जाएगी, तो आप प्लीज सब कुछ शेयर करिए।
नहीं, आपने दीपक बहुत अच्छी बात कही है कि स्टैंडर्डाइजेशन जो है ना, मैं आपको बताता हूँ कि खुद एक और से बहुत सीनियर थे जो कि CCRA से एसोसिएटेड थे, तो मेरी उनसे मुलाकात हुई। तो मैंने कहा कि साहब एक बात बताइए कि 50 मिलीसीमेंस के अंदर आप जो है देते हैं मेडिसिन, तो इसको डोजेस को रेगुलेट कैसे कर पाते हैं? फॉर एग्जांपल आपने 2 बॉटल बनवा ली 100 ml के, और इसमें से एक में 7-7 डोज एक दिन के साथ ना एक हफ्ते के साथ उसको दे दिया। तो वहाँ पर प्रॉब्लम ये आती है कि अगर आप डेली उसको जो है 10 अगर जर्स देने हैं, तो अगर उसमें से क्या पहली बात है क्या वो दोनों बॉटल में से डेली रोज के रोज जर्स करे या ना करे। सेकेंडली जब उसकी दोनों बॉटल खत्म हो जाती है तो वो आपके पास से बॉटल लेकर के नहीं आता है, तो आपको क्या पता लगे कि आपने जो उसको मेडिसिन दे रहे हैं उसकी पोटेंसी उसकी सेंस कहाँ तक चली गई है। तो उसके बारे में मतलब ये एग्रीड हुई कि देयर इज नो स्टैंडर्डाइजेशन, ये एक डेफिनेट प्रॉब्लम है। और 50 मिलीसीमेंस के बारे में जहाँ तक सवाल है, क्योंकि डॉक्टर RB पटेल इज नो मोर अनफॉर्चुनेटली नाउ, उन्होंने भी काफी काम किया है, लेकिन उन्होंने ड्राई डोज भी इस्तेमाल किया जी। तो ये जो है एक समस्या बनी रहेगी। जो लोग जो है वैसे कर रहे हैं कि एक एक स्मॉल पिल को लेकर के थोड़े से पानी के अंदर 1 ड्रॉप अल्कोहल मिला करके फिर जब डोजेज बनवाते हैं, उसमें ही कहते हैं साहब एक दिन का जो हमने निकाला उसको 3 किलो पर्दे से डिवाइड करिए और एवरी टाइम उसको जो है शेक करके टेस्ट करके फिर आप चलिए
जी
तो बात वही आती है कि डोज का स्टैंडर्डाइजेशन क्या होगा।
सर।
लाइक मुझे याद है जिन साहब को मैंने जिक्र किया था
जी
तो सीसीआर ने डायबिटीज के लिए सिप्लेंड्रा इंडिका मदर इनिशिएटिव को काफी काम किया। तो उन्होंने उस वक्त में उसकी डोज रिकमेंड करी थी कि 1 ड्रॉप पर केजी बॉडी वेट
जी
in the entire day 24 hours में that should be good। तो फॉर एग्जांपल अगर 60 केजी किसी का वेट हो
जी
तो उसको उसके केस में जो है हम कहें कि अगर 3 बार लें तो उसको 20 ड्रॉप का डोज होना चाहिए
जी
बट क्या एक्चुअल प्रैक्टिस में हम सब लोग उसको फॉलो कर रहे हैं?
जी
मेरा ख्याल है नहीं कर रहे। अपनी बात भी कह सकते हैं एटलीस्ट आई एम मोटिवेटेड।
सर मैं हमेशा ये कहता हूँ कि अभी तक तो हम लोग इतने भी एक्सपर्ट नहीं हुए कि हम अपने जो गोलियां हैं उनका इंडिविजुअलाइजेशन रोक पाए। अगर आप सिर्फ 40 नंबर की बात करेंगे, मतलब हम एग्जांपल ले लेते हैं कि 40 नंबर की गोलियां एक कंपनी किसी दूसरे साइज की, एक कंपनी किसी दूसरे साइज की, ऐसे डिफरेंट साइज अवेलेबल हैं। दूसरी बात ये है कि अगर आप सिर्फ कंसिस्टेंसी की बात करेंगे तो किसी की बहुत ज़्यादा मीठी है, किसी की बहुत ज़्यादा फीकी है, किसी का कलर वाइट है, किसी का कलर येलो है, किसी का शेप ओवल है, किसी का बिल्कुल राउंड है। तो अभी तक तो हम लोग सिर्फ अपने जो ग्लोब्यूल्स हैं जिनके लिए होम्योपैथी फेमस है, मीठी गोली, अभी तक तो हम सब इसी पे भी हम लोग एक साथ नहीं हुए हैं और हमारी गोलियां भी एक साथ नहीं बनी हैं। तो हमें होम्योपैथी में इस समय रिसर्च की कितनी ज़रूरत है ये आप सब लोग अपने आप समझ रहे होंगे। हालांकि ये सब बात डॉक्टर्स के लिए हो रही है और इसको मैं समझता हूँ कि हम लोग फेसबुक पे शायद नहीं डालेंगे क्योंकि फेसबुक पे जनरल पब्लिक भी है। और मैं आपको बताता हूँ कि आपके पास जितने भी ऐसे सेक्टर हैं जो रिसर्च बेस्ड हैं, आपके पास जितनी भी ऐसी फार्मेसीज़ हैं जो आपको मेडिसिन बना करके देती है, आप उनसे सोर्सेज पूछिए। बहुत सारी सोर्सेज मेरे पास शायद 2005 में मैंने प्रैक्टिस शुरू कर दी थी अपनी, और उसके बाद से मैं हर एक कंपनी से ये पूछता आया हूँ कि आप मुझे अपने ग्लोब्यूल्स की कोई कंपोजिशन की रिपोर्ट ला करके दे दीजिए। तो शायद अभी तक तो मेरे पास कोई भी नहीं आया। अगर कोई आपके पास आए तो मुझसे ज़रूर शेयर करिएगा, हम भी पता लगाएं कि आखिर ग्लोब्यूल्स में ऐसा क्या है। दूसरा एक सवाल ग्लोब्यूल्स पे ही जो मैं पिछले जी सर जी
देखिए इस मामले में मेरे ख्याल है अब तक शायद 2 या 3 कंपनी शायद हैं अब तक जिनके यहाँ ग्लोबल्स में कुछ कंसिस्टेंसी है। दीपक आप उन पर बात कर लीजिए। अच्छा एक कंपनी है जो कि बहुत फेमस है क्वालिटी के लिए अपने, तो उनके यहाँ मेरा तो खैर जाना हुआ था 1983 दिसंबर और जनवरी 1984 में। उसके पहले मेरे ब्रदर बड़े भाई से जो थे मेरे वो उनके यहाँ गए थे, तो उन्होंने दिखाया था कि 10 साइज की ग्लोब्यूल्स उसमें उन्होंने जिंशर वारेट का डोज मिलाकर एक ड्रॉप डाल करके 5 ड्रॉप सिर्फ एक ड्रॉप में, और उन्होंने कहा था कि 30 मिनट्स लगते हैं इसको यूनिफॉर्मली उसको जाने में, एब्जॉर्ब करने में। उसका डेमोन्स्ट्रेशन उन्होंने उस तरीके से दिया था। लेकिन अब कई बार आप देखते होंगे कि पेशेंट ने आपको कहा कि सर आपकी ऐसी दवाई नहीं, पहले तो उसका टेस्ट कुछ और था, बाद में उसका टेस्ट बदल गया। पेशेंट को तो ये समझाना होता है भैया लगता है तुमको दारू का शौक ज्यादा है। ये बात मजाक में हम लोग कह देते हैं कि तुमको दारू चाहिए, दवा चाहिए, फिर समझाना ही पड़ता है कि भी वो इवेपोरेट हो जाती है, जितने फालतू ड्रॉप होते हैं वो इवेपोरेट हो जाते हैं। तो ये देखिए खैर अभी स्क्रीन यहाँ से पीपीटी आ गया।
जी डॉक्टर सुकुल इज देयर। Sorry for interruptions, participants. Thank you for waiting.
এই পজ দেখাচ্ছে আবার পজ দেখাচ্ছে
ওখান থেকে ওদের দোষ তাহলে ওদের দোষ আমাদের রিজিউম শেয়ার পজ রেখেছে নাকি
রিজিউম শেয়ার আবার ওইটাই was resume share বলে ওইটা আবার নতুন করে করতে হবে এটা শেয়ার করব new share screen is sharing your screen is sharing দেখাচ্ছে এই অবস্থা করো তো পড়িয়ে দিলেই না বন্ধ হয়ে যাচ্ছে দেখো
सर आपकी स्क्रीन हमें दिखाई दे रही है लेकिन आपकी शायद पावर पॉइंट ओपन नहीं हो रही है
हाँ ओपन हो गया
जी
हो गया अभी
सर अभी यहाँ पे नहीं दिखाई दिया
अभी दिख रहा है कि स्क्रीन शेयरिंग
हाँ सर हमारे पास स्क्रीन का एक छोटा सा पार्ट आ रहा है
শেয়ার করা হবে শেয়ার করে স্ক্রিন ওখান থেকেই হবে হ্যাঁ শেয়ার
सर आ रहा है मेरा स्क्रीन
हाँ सर आप फाइल ओपन कर रहे हैं पावर पॉइंट भी ओपन हो रही है जी सर परफेक्ट है एकदम
So sorry for the inconvenience. It was really technical snag, and I'm really sorry for it.
No worries,
So,
no worries.
So going to the next experiment, it's another animal model that we used with the homeopathic medicine is the effect of Rhus and Causticum on rat adjuvant arthritis. So as I told you that in order to do some experiments with homeopathic medicines, we have to have the symptoms first. And these rats, they are not able to going to tell you the symptoms. So what we did some arthritis, we produced arthritis in the rats. So we put the injection FCA, the free and complete adjuvant, which will cause the inflammation and the pain as well, which have the similar symptoms of arthritis. They have the inflammation and pain as well. So on the extreme left, you can see this is a normal hind paw of a normal rat. There is no injection of FCA and no treatment as well. So this is totally controlled. And next to it, LIU is the left hind paw is injected with FCA and is untreated. So the maximum symptoms you will get here. There is maximum inflammation is here, maximum pain is here as well. Next, you see LIC, left hind paw is injected with Causticum. And then left hind paw injected with Rhus and right hind paw injected with Causticum. I mean, injected with FCA and treated with Causticum. So in homeopathy, there is lateralities. So there are medicines, those who work better on the right side of our body, and there are more on the left side of body. Those medicines are different. So Rhus is thought to be work more effective on the left side of the body, while Causticum on the right. So this is the reason that we chose both the limbs. So and while treated with Causticum, we used both left paw and right hind paw. These are the, by just seeing you this, you see there is a difference. I'll come to the result and the tabular part, but by just seeing with these pictures of the hind paws, you can see there is less inflammation is here, while treated with Causticum or Rhus tox, you can see more clear and right hind paw with Causticum. Now come to the results. This is median volume of paw in microliter. So the inflammation. So if you put some results, we have to produce some data. And you know, this inflammation and pain, these are the feelings. Mostly pain is a feeling. So you can, but there are methods by which way you can measure the pain. There are methods by which way you can measure the inflammation. So this is measurement of inflammation. What we did, there is a beaker filled with water, and which is being placed with a measuring cylinder inside of it, measuring cylinder. So once we tip or immerse the hind paw into the big beaker filled with water, the water comes out that is being measured through the measuring cylinder is the inflammation. More the inflamed, it will, the more water will come out. So this is exactly the way. So you can see this is on the extreme left, UU, this one is the normal. No inflammation and no treatment. This is the maximum symptoms is here, maximum inflammation is here. You can see 1600 microliter. You see the volume. And then comes to the treatment with Causticum, treatment with Rhus tox, and on the extreme right hind paw treatment with treated with Causticum. You can see there is significant difference from the control while being treated with Rhus tox and Causticum. This is an open field activity test. This way we can measure the pain. So we have to tabulate after all to produce or to publish into a good journal. So because pain is a feeling, so it's a, you know, it's very relative. So we have to measure the pain again to put into table. Open field activity test is a normal or standard procedure to measure the pain. It's been international method of testing pain or measuring pain. You can see there is an enamel board is here, and on the there is mark in a checkerboard fashion, and here is a mouse. This mouse was being put in holding with his tail. You have to put into anywhere, any of the box. This is the normal nature of the box for mouse, that once you put into the box, it will just move very fast. Those who have less pain move very less. Those who have pain, and those who have severe pain, they would hardly could able to move. So this is the way it crossed the number of boxes. We have to count in 300 seconds. This is a cut of time. So in 300 seconds, the number of boxes traversed by a single mouse is the measurement, exact measurement of the pain. So here comes the tabular form. We put into the on the extreme left, you see it traversed so many boxes, 160 times it crossed the boxes. So maximum, there is no pain at all because it's a normal mouse. And here you will find the maximum pain. So it could hurt, it could traverse almost 80, 90, around 90 boxes. So you can see the maximum pain is here. And here again, while treatment with Rhus tox, Causticum, and while treated with Rhus tox, this one, and again treatment with Causticum, they have significant difference from the control. So this way we can also tell, and this has been the statistics been done by two-tail man-Whitney test. So this is statistically significant. This one is another method. This is a very popular method to measure the pain. It is inclined floor method. You see there is an iron grid that is being placed 70 degree, and you have to hold with the tail of a rat and put it on the top of the wire grid. Here there is, you will find the bedding materials with food. So once the mouse is being placed here, and once it will see its food, the normal behavior is that it will come to the food. So those who have less pain, they will come very fast, and those with more pain, they will come very slowly, but it will come towards the food in all the cases. So this way we can also measure the pain. You see number of seconds taken to reach base. It could hardly take not even 5 seconds to reach very quickly to the base, to the bottom of the bedding material. And this was the maximum pain is here because no treatment was given here. This could took long time, nearly 28 seconds or something like that to come to the bottom. And this is treatment with Causticum, treatment with Rhus, and right hand treated with Causticum. So all these have significant, though very less, but it's significantly correlated with this 2-Tellman-Whitney test. So thereby we could able to see that the pain as well as the inflammation can be reduced with the Causticum and Rhus. As a homeopathy doctor, there is nothing new in it. All we know that Causticum and Rhus we very frequently use every day to the arthritic patients. But this is the procedure to demonstrate that yes, Causticum can reduce inflammation or the pain as well, and Rhus also. So to conclude with this experiment, homeopathic potencies have effect on animals, while Causticum is more effective on the right side, Rhus is more on the left. Causticum and Rhus are potential homeopathic medicines in rat arthritis. This is the FTIR that we used while studying with some physical properties of homeopathic dilutions. So this is another one. On the left, you can see the TV visible spectrophotometer, and this is on the right with the Peltier system, the temperature control. This is not we have UV spectrophotometer in Sukul Institute, but not with the Peltier system. So in some most of the cases, what we do, we collaborate with some institutes and research institute or universities here to work with such machines or very sophisticated instrument. This one another in energy dispersed X-ray spectroscopy. This we not did that much of work, but yes, of course, we did a little bit. This was as far as the experiments with the animal model were concerned. Now I come to the experiments of homeopathic medicines in plants. There is an emerging subject that is agrohomeopathy, and there's a lot of research, especially in Italy, has been going on with the agrohomeopathy, that homeopathy medicines work with the plants. We have taken this idea. You see in this picture, there is a baby monkey. It's sucking its milk from his mother. And it's not only sucking the milk, it also sucks the each and every ingredient to build his own body. Not only the body, the each and every organ, the mind and everything to grow itself. So this is being universal. Suckling of milk from his mother in human and in other animals as well, of all the mammals. What it sucks exactly, I told you that it's all the sucks, all the every ingredient that is to survive. For the doctors, with the homeopaths, we have been experienced with such so many newborn babies as a patient, or the babies as a patient, that sometimes we put or we give the medicine to the mother, so that with the mother's milk, those who are feeding, with the mother's milk, the medicine goes to the baby and the baby gets cured with it. So this is very common to all the homeopaths, that we give to the medicine to the mother to cure the baby. So you can see that medicine also being transferred from mother to its sibling or the baby. Now this idea we put into a plant model in the way that I'm going to tell you. The plant cells, they have the ability to recognize self from non-self. Which one is bacteria or virus and which one is own part. They have that ability to differentiate or to recognize. The results of these molecular recognition events in response to a local stimulus. It can be local stimulus, can be bacteria, can be fudge virus or whatsoever, as transmitted to a distant parts of the plant. The global molecular network, or GMN, it's a very new concept. It's been 2006. So that all the cells of each and every part of a plant is being connected, or a living animal is being connected. So it is a continuous. How it is a continuous process? It is being continuous through the cell, and through the, in per se, it is cell or the water. So water as a continuous liquid medium inside and outside the cell, because a cell, single cell, contains almost 90% of water. So with the water, each and every cell is also connected, and you can connect the cell if the water can also transfers from one cell to the other. There are covalent forces, non-covalent forces, van der Waals, acid base, and electrostatic. These forces are always act into. Any local change in water structure transmitted the entire GMN of the concerned organism. This is like in a morbid condition. You can see the taste of our tongue is different when we are having a fever, and in normal condition it is different. So it also changes the GMN, and in result of that, this much of symptoms we can get. So a potentized homeopathic drug act through the global water structure in association with the GMN. Our purpose is to see the effect of heat shock protein and of homeopathic treatment could be transmitted from one plant to another through a column of water in a tube connecting the two plants. I'll come to the model, then it will be more clearer to you. The materials is the Caupi vignanuculata. The surface of the leaves was sterilized. There were 5 batches. 4 batches were arranged in pairs and kept side by side. Pots of each pair were 85 centimeter apart, and each set containing 20 plants. 1 mature leaf of each plant of the 2 sets of pairs was immersed in sterile tap water contained in a glass vial. A soft polythene tube 2 mm in diameter and 90 sterile tap water with their open ends immersed in a pair of beakers in which leaves were immersed. Here is the model. You see, this is the cowpea plants put into earthen pots. This is the filled beaker with water. This is the polythene tube, white polythene tube. And inside a polythene tube, there is a cotton thread to ensure that it has connection. Both the ends of the polythene tube is being immersed to the corresponding beaker. So by this way, you can see that all the columns or the rows are being arranged. So each way it is being connected through a polythene tube, and inside the polythene tube there is water filled. So in other words, each has connection with water to the other plant. So this is exactly the connection I started with this experiment, that is the universal of the baby suckling the mother. You can see, you can tell it as a mother, you can tell it as a baby. If it is so, you see the suckling and the transfer of water, the milk is here also. We put it in this way. In homeopathy, the burn injury, the drug of choice for the burn injury is Cantharis, and the mostly used, the most effective potency of Cantharis is 200 in a burn injury. So because these are plants, so we have to create the symptoms first to obey the principles of homeopathy. What we did, we burned the leaves of these plants, right? So once we burn the leaves, we produce the symptoms. Now we are able to give the Cantharis as a treatment. If I burn the left side, the leaves of left side, the right side is not being burnt or not being given to the Cantharis treatment. So this part is being burnt, and also treatment with Cantharis 200, and this part not burnt, not being given treatment. So likewise this way we goes. Now while come to the, this was the protein that expressed while being burning. There was HSP or heat shock proteins that we able to find it with this FPLC. How we could separate the proteins? The leaves were harvested 1 hour after heat shock or after the burn, and 1 hour after Cantharis treatment. Treated leaves and those immersed in water were not harvested. Protein separation was done by FPLC. This is the result. And this has been in the mode of retention time, and this is absorption. These peaks are the protein peaks that we have found through the FPLC result. You can see this peak is the maximum. The highest peak is here of the protein. And on the left here it is the treatment. On the right, this plant is connected. So we have separated protein of the treated plants. We have separated the protein of the plants, those were not treated, but connected with the treated plant. You can see the nature of the proteins that has been expressed is quite similar with the treatment. And these proteins are HSP or heat shock protein. These will heat stress protein. So this will only come up while this injury of heat or burn will be given. So there is a new expression of proteins that has been come. It's being connected here. And this is the treatment. Cantharis treated and Cantharis connected. On your left, you see the treated plant. This has been treated with Cantharis. While being treated with Cantharis, the protein profile is changed. The heat shock protein, the nature of the heat shock protein is changed, unlike the without treatment. But here, we have not given any treatment with Cantharis. We have not burned the leaf as well, but it also shows again the similar proteins, which are absolutely quite similar with that of the treatment. So we assume that this has been possible because there was a connection through the water, through a tube, polymer tube. How the discussion of this experiment, the results very clearly demonstrate that the effect of any treatment on a plant can be transmitted on one plant of the same species through water. I just leave through the discussion part, and now I come to the clinical part. So this is very interesting experiments that we now discussed with the first one of the first two with the animal model and the next one with the plant model. And in all the experiment, it has been proven, demonstrated that homeopathic medicines are really effective in all the experiments which have shown positive results. Now come to the clinical part of today's lecture. Now, once this was maybe a couple of years back, that one in the evening I received a call from Bangkok. As in the beginning introduction, I told you that I also work in Thailand. So I received a call from Bangkok that someone from an anxious mother, that her son is admitted into a very renowned hospital in Bangkok. It's a 5-star hospital, and for the more than 30 days, yes, it's more than 1 month, a 28 years old patient is being admitted into a hospital. So the reason she called me is for the septicemia for the 3rd time. So there had been 2 times earlier which he could recover, but this is the 3rd time, and this time the doctors treating him in the hospital were not very confident enough to treat with, and that's the reason this homeopathy is introduced with me. So I flew to Bangkok the every next day, I mean day after, and went directly to the patient in the hospital, and there I could see that boy with a very thin thin body, just to the purple color of his skin. The body is so toxic. The blood is so toxic, and he was lying in the bed. The first reaction was is to survive, how he could survive or how could get rid of this septicemia, because we know that septicemia is fatal and we have hardly few hours in our hand to treat with. So he was having fever and I gave him first Rhus tox, but within a couple of hours I could even realize that Rhus tox is not the medicine. Although it was my previous experiments that I cured septicemia with Rhus tox, but this time it couldn't work. I changed to that late night because I reached there in the evening, 6 o'clock around something evening, and the late night I changed it to arsenic album. The arsenic album in the next morning, the fever came down, but it was still there. But so until and unless the fever goes, we cannot ensure with the septicemia, and we are still in danger. So I again changed the medicine just with 1 dose of arsenic again. I changed the same night. I give calichlor, and that really the next morning there is no fever. Although arsenic put the fever down, a lot of down that could, but there is no that much of response from the patient. So I changed to calichlor, and the next morning there is no fever at all, and the patient was get rid of septicemia. That evening, the medical report came with that the patient is having from the hospital, the patient is no more septicemia, but we do not know how. So the hospital authorities were not aware that the patient is having hello, can you hear me all?
Yes, sir.
Okay,
We are
fine,
listening.
thank you. So the reason that I was called for this patient is not the is the septicemia, but septicemia is not exactly the disease that he was admitted into the hospital for more than 30 days, and the reason was that the disease what he was having is the SMS syndrome. Now, what is SMS syndrome? Superior mesenteric artery syndrome is a gastrovascular disorder in which the third and final portion of the duodenum is compressed between the abdominal aorta and the overlying superior mesenteric artery. So it makes a kind of knot, so that makes it a restriction, a stricture like that. So this rare, potentially life-threatening syndrome is typically caused by an angle of 6 degree to 25 degree between aortic aorta, abdominal aorta, and the superior mesenteric artery, in comparison to the normal range of 38 to 56. So we can see the normal range and you can see the disease range due to a lack of retroperitoneal and visceral fat. So this is exactly the SMS syndrome that the patient was suffering from. These are the symptoms: abdominal fullness, there are some cramps, vomiting, anorexia like this. And there are other factors that may include to this syndrome is the prolonged bed rest, weight loss, rapid growth, previous abdominal surgery, increased curvature in the lumbar portion of spine, or sphenoidosis, use of body casts, and these are some other factors that may conclude. There are some other diseases like pancreatitis, peptic ulcer may also contribute along with SMS syndrome. This is the first report that came in the December, late December, and it has been diagnosed as Crohn's disease. There was no SMS syndrome that time, but colonic stricture was there very much. You can see also the stricture, the polyps. This is in the January, 26 January. You can see the CT is clearly indicate that the SMA syndrome. So again, in that day, there was nasojejunal NJ tubes insertion. So there were 4 tubes were inserted to supply to water, to supply to carbohydrates, proteins, and lipids, the essentials of living. These are being circulated because the wall of the intestine is so thin, it's like a paper. Even a single piece of rice, if somehow could enter into the intestine, may pierce the wall of the intestine and to come into the peritoneum, causing the peritonitis, which may ultimately cause to death. So this is so dangerous, and that's the reason everything was supplied directly through the tube. You see, after the patient was get rid from septicemia, I started the treatment of this SMA, and this is in the January, and this is the reports of the March, that almost complete resolution of duodenal obstruction. There is no duodenal obstruction. It's not normal small bowel transit time. So also this could happen. This is totally a case of surgery, but it was in the case, in such case, surgery cannot be processed. It is because the thinness of the intestine. So sometimes what they do, they put the stool and urine out with a bag, but not to the polyp or not to the stricture. These are the medicines that are used is the Naxphom, Thuja, Chelidonium, Lycopodium, Phosphorus, Sulfur, Calichlor, Arsenic album, Rustux, and Veratrum album. This is a case of cervix cancer. You see, no significant mass is seen. This is the same case of CS cervix, known case of CS cervix at present showing no mass. So this patient is still under my treatment, but it's a very successful case with the homeopathy medicine that cancer in cervix can be cured. This is a benign tumor that I show pass very quickly, as I wasted a lot of time out of this technical problem. So this is the tumor. You can see the shortening of tumor has started already with the medicine Thuja, Arnica, Sulfur. You see a cyst here inside the mouth, and it's cleared here. Calcareous, Arnica, Thuja, and Hypericum. Alikodama. See, there's a lot of development with Calcareous, Thuja, Pioneer, Sulfur, Tuberculinum, Marxol. I didn't use all the mention the potencies because mostly I use potency 6. So this is the maximum effect I got in 6 potency. Use also 30 potency, hardly used 1M in such cases, but I found that tumors after if you give Thuja 1M and then if you give Arnica 6, it works good. This is leukoderma. See the spots here and see only the pinkish tinge is here. The tumor again here getting smaller with carbonium. It's a very hard tumor. So carbonium, Seclalava, Arnica, Thuja, Bacillinium, Calclea, Floor. It worked well. Psoriasis. Is, psoriasis is very hard to cure, but there are cases that can be cured with sulfur, Thuja, Arnica, Bacillinum, Calcarea, Carbonium, Marxol, Lectrum sulf. It's an extensive case. This is the, you can see the cracks with the bloods. This is the deformity of deformed arthritis. You can see the fingers, and with the medicine after C, you can see the fingers are quite good. The straightening has appeared with colchicum, arnica, causticum, thuja, sulfur. This is the same case of the psoriasis. You see only a scar is left behind, but no symptoms. Case of skin cancer, see here, is being arrested, could be arrested with thuja, arsenic, euphrasia. This all goes with the symptoms. Alopecia with Nux vomica, Marxall, syphilinum. It's a benign tumor with thuja, calcarea carb, arnica, tuberculum, sulfur. This tumor was there for the last 12 years, and it was not red when the patient came to me. So it was just as the skin color, but after I think a couple of weeks or so, maybe 1 month, it started getting red, and soon after that, it got burst out. So it's a 12 years it was there, and there was subsequent. It was just a little bit of stricture was there, a line to join the skin, but it was the tumor was no more. This is a very successful case in the case of ulcer in legs. You see, the ulcer was so severe that this patient was advised to ampute her leg. Amputing legs is a very tragic situation. So they came to me to treat, and maybe the last resort for this patient to treat with homeopathy. And initially, though, I didn't find that much of good response because it was a chronic ulcer. And you can see the gigantic side of the leg. It is so inflamed. The ulcer, every time it was oozes, there is bleeding, there is tremendous pain, burning, so all with the symptoms. So this was the second stage. You can see the joining of and the fusion of the skin tissue, and only this part is being, open. And on the third stage, you could see that there is each and every part is joined and fused. And you can see there is a difference in the size of the leg. It's being absolutely normal size of the leg. And here you can see the size. So this is a very successful case of leg ulcer, and where it has been so severe that it had no option but to ampute the leg. Another case of extensive alopecia. You see here, and there is a growth of hairs. This is psoriasis again, pulmonary psoriasis. I pass quickly. This is the uterine fibroid. So only no fibroid, only retroversion is here. This is a case of a Thai patient with left-sided hemiparesis. So this was the discharge summary of the patient, and this is the CT brain. You see acute infarction at right corona radiata, although there is no intracranial hemorrhage. The time that the patient was having that hemiparesis, I was not in Bangkok, so I was here in Kolkata, and I received a call that this patient has suffered from this hemiparesis and admitted into the hospital. The hospital, as you know, because she didn't have that much of hematoma or hemorrhage, so they have nothing much to do with this hemiparesis cases of hemiparesis. Was they were doing with some the normal exercises, the physiotherapy kind of thing. The Thai, they have some special, massage, these things, so that are really helpful. So she was basically doing with some little bit of medicine for the seduction, the sleep, because in such cases there is a mental distress, and the sleep is being highly disturbed, and it may cause another attacks of subsequent attack with the rise of the blood pressure because of such mental condition and resulting less sleep, resulting high blood pressure. So just this kind of treatment, the partial or associated treatment was going into in the hospital, but not the direct treatment because they do not have actually. So I advised the medicine over phone, and she was started this medicine, and I think around 3-4 weeks I went there and I visited the patient into the hospital she was admitting into, and you can see this how much she was improved, that she could able to hold both the legs almost above the hands almost similarly. Right hand is normal, the left hand is hemiparesis is here. So but you see almost there is not that much difference in just 1 month, and that is the beauty of homeopathic medicines to treat or to work in a patient. And the patient could able to walk also, and the time I was there the patient could able to move to his washroom, so she could able to walk within just 3 weeks of medicine. You see, so with that treatment of hemiparesis, this is a very successful, we have very successful medicine. Even though there is hematoma, sometimes surgery, they are not advising surgery because of some age restrictions. And so there are so many other factors that in the cases of hemorrhages they do not operate. So in those cases we have very good medicines for the hemorrhages to reduce and to disappear and to be just a normal, as well as the symptoms are being also reduced and to be work, if not normal, but like a normal. This was a patient from another Thai patient who is 32 years old, and he was suffered from dengue. The time he was having this dengue and admitted to a hospital, he was in up country, not in Bangkok. But I was fortunately in Bangkok that time, the time this patient was get hospitalized. So we sent the medicine to the patient, the patient family of the patient, and you see the platelet is 216,000 on 23rd. 26th, it came down to 11,000. It was repeatedly checked. Because the patient was into the hospital system, so he was giving the platelet infusions. But within 1 hour or not even that, the platelet again comes down. So on the 27th, it is 13,000, the platelet count. High fever. Again on the 27th, there is the other parameters of the enzymes, the liver enzymes. So they are with the high 207 SGPT, SGOT, 252 of SGPT, and the low sodium, low carbon dioxide concentration in the blood. On the next day, 28, the platelet comes down to 5,000. So I took the patient when the platelet was 11,000. I mean 13,000, not 11,000. So it came down to 13. So that time it was just going up and then down. But this time, rapidly going down. And the patient family, they were all crying. I was almost, because I could not able to see this patient because some 700 miles from the city of Bangkok. So it was all going through the phone, and they stopped the treatment because the platelet infusion was not working at all. So the patient is just waiting for to die. And you see here is 4,000. Is almost the life is going to be, it's on the 28th, the same day, 5,000, then again on the same day, 28th, it's 4,000. So very quickly you can see it's coming down, where it should be around 140,000 at least. And then first it comes up 31,000, it shoots up just after 2 days. And the first again 73,000. See the rise. Again on the first, the albumin a bit low. Again on the first, 73,000. So this, the medicine I used here, I changed just once. I changed first. I gave bryonia, but there was, you see, I was not there on the side of the patient. So whatever going on through the phone, over the phone, and so after that, the next day the fever was there, and moreover the platelet was coming down so fast. So I changed it to gelsemium, and ultimately the gelsemium was the medicine that it could survive, and ultimately the patient survived and they were happy. You see, on the third, 85,000, second rising and come to the normal. So that is the end of my clinical part, and now the concluding part. I will not take that much of time, I think, because we are already late. So this is, I'll now take you to the Western countries, that how homeopathy and alternative medicine is there. You can see that it's a field clinic hospital in Stuttgart in Germany, and this is on the rooftop. Most of the hospitals, they are put into the rooftop, and you can see if you go inside into, I was one of the visitor there with the team in I think 3-4 years back. So this is, you see, this is the inside of the premises of field clinic hospital. Inside you will find the small trees, small plants being planted here, and the rooftop is see-through. The sun can come into inside for the plants and for the goodness of the environment here. And you can see the sun here. This is inside the premises. So all, it's the motto of this hospital to be in a natural way. The environment inside and outside will be natural, and this is on the rooftop. So you can see, if you go stand into the balcony of the hospital, you can see a lovely view of the mountains. This is the same hospital. The infrastructure wise, it is, although alternative medicine hospital, but infrastructure wise it is as good as a modern hospital. It's none less than a three-star property. If you go inside into the corridor out there, you see the beds, and most importantly, the patient is always getting to the touch of the environment. It could feel the sunlight, it could feel the weather, the every change, because in Europe there is, the weather is changing continuously. Each hour the weather is changing. So that's very important, that where you are staying during your disease days, the environment around. So that's the reason, is the main reason is the to place the hospital in a rooftop and to feel each and every change of the environment and weather. He is the director, Dr. Stefan. This is another hospital. It's a very old hospital, Paracelsus Hospital in Germany again. See the corridor, and again you see the window is see-through. The patients are being admitted here. You see the modern machines that being fitted with the bed, and again the environment which they emphasize maximum. It's unlike the hospital here that we are just confined with the walls. We could nothing see, only the walls everywhere, but we could not see, there is, you could see the every changes of weather. This is the Glasgow Homeopathic Hospital. You know, this is a very renowned hospital. This is a whole hospital again on the rooftop. So this is the inside of the Glasgow Homeopathic Hospital, the corridor, and you see the concept is being same here as well, of the environment is touching the patients. The Royal London Homeopathic Hospital now is being termed as the Royal London Hospital for Integrated Medicine. And I was there, and I was fortunate enough to check a patient there in the Royal London Hospital with a team of doctors headed by Dr. Brian Kaplan. Many of you know Dr. Brian. And Brian was sitting here with the patient is here. You see the simplicity, and the paperboard is here. And we, the 6 doctors, were sitting in front of here. So it was around more than 2 hours we were consulting with the patient. So this is exactly the way that in Europe or in United Kingdom or in United States they do. They do maximum time to a patient, taking all the symptoms out, particularly how the patient is mentally going through. It is not possible for a 5 minutes, 10 minutes consultation to know all the symptoms of the patients. In most of the cases, the patients, they also not willing to tell you the symptoms directly until and unless you dig out the symptoms. So it is both the ways that you ultimately you have to know the symptoms to choose the medicine right and to work with. So that's the reason they spend so much of time with a single patient. And this is the book by my father. As I told you in the beginning, that our Sukul Institute is being established by my father, Professor N.C. Sukul, who is a former dean in the Faculty of Science and former professor and head in the Department of Zoology in Vishwabharati University in Shantiniketan. So this is the research outcome of his book, High Dilution Pharmacology and Homeopathy. And there is another book, The High Dilution Effects, Physical and Biochemical Basis, by co-authored by me. This book was published in Kluwer Academic Publishers. So this is a purely scientific publisher that they published a book on the research of homeopathy. And this book was so popular that it was being translated into Italian, that the Pharmacology del Alte Delusion or something like that. I'm sorry, I cannot read it out. But this book was so popular. The same book was translated into Italian version. Very recently, we have another publisher. I am the co-author of this book. You see my name here. Transdisciplinarity and Translationality in High Dilution Research, being published from Cambridge Scholars Publishing. So this, all the books you will get in Amazon. This is again the outcome of research from all the scientists throughout the world, research with high dilutions. We have, as I pointed out, that we have clinical and experimental homeopathy, international peer-reviewed journal. Quarterly, we publish the issues, and I asked you, request you to all the viewers to please submit your articles into this journal, as this has a tremendous wide, indexing journal. It has been indexed with so many indexing authorities. We, Sukul Institute, also collaboration with Natural Praxis, and we offer courses, diploma courses, purely online. Recently, we have collaborated with the Bangladesh IPTM to start the courses, and this is the address. You could reach it out. This is the last year in November 2019. We host a World Congress, second World Congress on Homeopathy and Traditional Medicine. This is in Bangkok in Thailand. So there were around 20 countries. There were participants from all over the world, and there were more than 200 odd participants. So this is some few snaps of this. He is Dr. Tewan. He is the director of the traditional medicine in the Ministry of Public Health in Bangkok in Thailand. So he is, maybe you know all, most of them. He is a very renowned scientist, and he is Professor Baumgartner. He is Mr. Paul from Bangkok. He is also the director of this Paul Narula Academy. He is the first secretary of Sri Lankan Embassy in Thailand. My father, Professor N.C. Sukul, we are handing over an award to Professor Baumgartner for his contribution to the research on high dilution. Another angle shot, the food that on the gala dinner we served. It was on the rooftop of Holiday Inn, 29th floor. You can see the city of Bangkok, the night view, the lovely cultural evening, the dance by Thai models, Mongolian models, and this is the cemetery of Samuel Haniam. This is the holy place for we the homeopaths. And lastly, to end, I would just suggest to all the viewers that please take arsenic album 30 once daily for 3 days for this prevention of COVID-19. I repeat, arsenic album 30 once daily for 3 days for the prevention of COVID pandemic, and you repeat this dose after 1 month. So every month you take just for once daily for 3 days of arsenic album 30. I wish you all a safe go to this through this pandemic, and I hope with the potentiality of homeopathy, it is being proved that we will able to come out from this pandemic and enjoy a normal life. I am really thankful to your patient hearing, to all the viewers, and especially to the organizer. And I am really extremely sorry for the pain that you took during the technical problem. Thanks again. And it's over to Dr. Deepak Sharma.
Thank you, sir. Thank you. This is really a wonderful session about the research in homeopathy. So I request you to please switch off your desktop and come with the word video on a mobile. That will be better. Dr. Shirta,
I think I just taking some another. If we can continue with this desktop, is it possible?
Yes, we can.
I have to rejoin again, and it takes.
Okay. That's good. So, Dr. Shweta, please ask the questions we have in the chat.
Very wonderful sharing by Dr. ANIRBAN Sukul. Here's one question from Dr. Wahi sir with regard to his clinical trial with the Rustox and Causticum. So in that case, how to individualize the medicine, how to observe the behavior or sensation part. Is that that experiment is only to demonstrate the action of medicine?
See, there are so many other factors and other symptoms of arthritis, but our motto is to demonstrate only the inflammation, the main symptoms, and the pain. So we work with these two factors only, because there are some mental situation as well that with the arthritic patient it may change, but we are not into that. We just able to show that Causticum and Rustox is able to work on animals. So that's the reason we took the main symptoms of arthritis is the inflammation and the pain.
So it is just to show the action of medicines, right?
Yes. And to demonstrate that it works on animals.
Okay. So there's one more question. First of all, congratulations for the wonderful results you got in the surgical cases. And Dr. PP asked, what is the basis of prescription in those surgical cases?
See, it's all with the symptoms, but in some cases of surgery cases, the patients come to you with some extreme pain, maybe some extreme disorder, distress. So in those cases, we have to give some relief to the patient, because we know that it's a chronic disease and this is not going to go very soon with the medicines that we are going to prescribe. So first of all, you have to give you a good relief to the patient, so that patient started able to trust you. So the motto of the and then ultimately out of the disease. So this is the second part. What as far as I am concerned, I do it in this way. So in that way, absolutely symptom basic, of course.
So, sir, in that cases, you prefer single doses or multiple medicines?
I always use only homeopathy, potencies and the mother tinctures. So other than these two, I hardly use biochemic. In some cases, I use magphos, but that is not my usual practice. Usual practice is the potencies, low potencies. I will tell you again, is 6 and 30. 6 is mostly widely used potencies that I use, and mother tinctures.
Okay, sir. Thank you so much.
Well,
This is really wonderful session, sir. And I added to your comment that in Calcutta or in the West Bengal, the homeopathy is going beyond to the limit and using the different potencies and different category of the medicines and different type of potencies to the patients. And in other states, there are different criteria to give the medicine. They are coming with the single doses or just for the sake of, I can say the single doses. But I request to everyone to use the homeopathy only, either in the form of
absolutely.
mother tincture, either in the form of the 1x or 2x or 3x 30. This is all depend upon you. You just use only the homeopathy. So this will grow the homeopathy. So on behalf of Delhi Homeopathic Medical Association, I really thankful to you, Dr. Sukul sir.
Thank you,
I
doctor.
request our patron sir, Dr. VP Singh, to thanks to you.
First of all, I would like to thank you our today's speaker, Dr. ANIRBAN Sukul, for his very beautiful and educative lecture on this a particular subject. Now we can learn so many things from such type of so many cases of the surgical, which are treated by only single dose and lower potency. This is very educative lecture from Dr. Sukul. Thank you, Doctor. Thank you.
Thank you, sir. Thank you very much.
Thank you, everyone. And I request to take membership of Delhi Homeopathic Medical Association at www.dhma.in or WhatsApp me at 9711153617. You can also write us an email at dhmadelhi@gmail.com. So it was really wonderful meeting. So thank you so much. Thank you all participants. It's about 10:40 here. So I request to go to sleep and so thank you so much. Thank you, everyone.
Thank you.
I just ended the meeting. Thank you, Sukul sir.
Thank you, sir. Thank you all. Thank you, the viewers.